What exactly is schizophrenia? If schizophrenia had a nickname, it would be misunderstood. That's because it's every shade of complicated. And, to confuse matters more, each of its symptoms appear in at least one other psychiatric disorder. The easiest way to make sense of it is to say what it's not. Schizophrenia is not characterized by split or multiple personalities, aka dissociative identity disorder, or the extreme shifts in mood that come with bipolar disorder. And people with schizophrenia aren't prone to violence, are genius, for that matter, in spite of what you might have seen in the film, A Beautiful Mind. The hallmark symptoms of schizophrenia, hallucinations and delusions, bizarre thoughts and perceptual difficulties, are typically what we think of. But ultimately it's a brain disorder that involves progressive deterioration in cognitive abilities, explains Dr. Frank Chen, MD, Chief Medical Officer at Houston Behavioral Healthcare Hospital in Texas. Unfortunately, it's an illness that doesn't get any better, but you can use medications to palliate some of the symptoms and improve quality of life. Because schizophrenia is tricky to diagnose, numbers on its prevalence vary, but experts estimate it affects about 2.4 million Americans. The disorder affects more men than women. The ratio is 1.4 to 1, and it strikes men earlier, too. Age of onset for men tends to be in the late teens to early 20s. For women, onset typically occurs in the early 20s to early 30s. Experts believe this has something to do with the pruning of neurons, a process that takes place after birth in babies, which happens later for women than for men. How schizophrenia manifests. People with schizophrenia experience what's called a psychotic break, which is the onset of psychosis. It's when their mind is overtaken by hallucinations and/or delusions that make it hard to know what's real and what's not. But while the word break sounds sudden, symptoms of schizophrenia don't happen in a single traumatic moment. Instead, they are usually gradual and can progress for years, and they can be easy to miss, until they're impossible to ignore. Here's how the disorder can manifest. Early warning signs. Also called the prodromal phase, early symptoms of schizophrenia are those that happen before a first episode of psychosis and usually during teenage or young adult years. The duration of the prodromal phase can vary, and in some people may last over 2 years. Early symptoms can be difficult to detect because they can mirror the typical behavior of an angsty teenager or young. When individuals first experience some of the bizarreness associated with this illness, they kind of look depressed, says Dr. Chen. They become much more reclusive. They don't talk as much. A lot of times they're hibernating in their room. Like most teenagers, they don't share their thoughts with their parents. It's easy to think it's teenage angst, or that they're just going through a phase. According to the National Alliance on Mental Illness, early signs of schizophrenia to look out for include a steep drop in grades or job performance, trouble thinking clearly or concentrating, suspiciousness or uneasiness with others, a decline in self-care, like not showering for days, spending a lot more time alone than usual, strong, inappropriate emotions such as laughing when someone dies or having no feelings at all. The symptoms of schizophrenia. Symptoms of schizophrenia are generally put into 2 categories, positive or negative. But don't be fooled by the term positive. These symptoms aren't positive in the good sense. Positive symptoms are experiences which are not generally part of everyday experience, says Dr. Russell Margolis, MD, Clinical Director at the Johns Hopkins Schizophrenia Center in Baltimore and Professor of Psychiatry and Behavioral Sciences. In other words, positive symptoms are created or added to a person's life by the disease. The experience of positive symptoms in schizophrenia designates that break with reality that comes with psychosis. Patients can experience either hallucinations or delusions, or both simultaneously. Just like positive schizophrenia symptoms are added to someone's life, negative symptoms are what the disease takes away. They are the absence of something that's normally present in life, such as goals, interests, and initiative, says Dr. Margolis. The person just doesn't want to do things anymore. They may just want to sit around all day. They may not speak very much or have spontaneous ideas. It's like everything is turned down.